one of Anna's comments that in fact patients want to help, members want to help, is absolutely so true, and it is an incredible untapped resource. And one of the things, as CareOregon is a Medicaid plan and has been a major Medicaid plan in Oregon for all of its history. And one of the things that is so clear is they not only want to help the system, in many cases they also want to contribute to each other. There is an incredible ability we have to improve our systems if we'll just stand in the circle and pay a little bit of attention to what's going on. But I want to move on to what my job really is now, which is basically to give you a real brief introduction and let you hear some patient voices. And to do that, we've got two leaders in organizations who are involved, and I'd like to briefly introduce those, and then they will help manage this next session. Martin Taylor is the Public Policy and Member Centricity Director at CareOregon. And I can tell you that Martin walks the walk. He is a constant voice inside CareOregon for making sure that we are paying attention. He connects our members directly to our board and our board committees. And I think that's exactly where it actually needs to happen, as well as in improvement work. Cindy Klug is the Director of Education and Medical Home Development at Providence Medical Group, and I had a nice chance to talk to her for a few minutes before this program, and I will tell you, she is also a champion. And let's turn it over to them and to our members.
So while Angela gets the slides prepared, I'm going to invite our panelists to come up. And let me just note, this particular group of folks, PeaceHealth Systems, Providence Systems, and CareOregon, we really met each other in 2011 through a really important piece of work that the Robert Wood Johnson Foundation funded and Quality Corp administered. And Mary Minetti was our lead staff person, and it was called the PEN Group, which stood for the Patient Engagement Network. When we started this work, I think all three organizations were grappling with the kinds of questions of what kind of value do you get from advisor volunteers? Can you really hear what they have to say? Are you going to be able to take advice if it sounds sometimes like criticism? Is there going to be a gotcha moment? Will folks come and stay? Will they stick? And I think in our experience over the last 2.5, 3 years working with this, it's very clear that the advice has been invaluable, that the members do come again and again, that we do have the ability to hear this kind of input and get better, and no one's out there to get a gotcha. And so I look at that and I say those were all really valuable learnings. My most valuable learning is that the folks that we work with at CareOregon, and I'm sure that's true at PeaceHealth and Providence, we didn't just discover member advisors, we made friends. We have a group of folks that are very committed to our organization, but we're also very committed to them as individuals. This isn't hard work. In fact, it's enriching work, and it makes all of us better. So let's hope that a conference like today's conference becomes an always event, and that we get to do this again every 2 or 3 years. Without further ado, I want to introduce first Cindy, my colleague up here, and now our 3 patient advisors. I'm going to do this a relatively brief introduction because the first thing I'm going to ask them to do is to introduce themselves and tell you a little bit about how they got involved. So I'm not shortchanging them. Dana Gamble is with PeaceHealth's PAC, which stands for Patient Advisory Council. Kay Dickerson is with CareOregon's CHIA, and that's the Community Health Engagement Advocates. And Margie?
Yes, Margie.
Margie Turner is with the Providence PFAC, which stands for Patient and Family Advisory Committee. So thank you all for being here. And I'm going to start by just having you go down the line and take turns. Tell us how you got involved and connected to your advisory council initially.
Well, my story starts with my husband and his mother. My husband started going to our doctor first. His mother, we convinced that she needed the same kind of wonderful connected care that he was getting. So we had her go, and then all of a sudden I got very jealous because I wasn't getting the same type of wonderful care. So then I started going and becoming involved in both of their care. Our doctor recommended me for this new council they were putting together, patient and family advisors, and thought that I would be one of the perfect candidates for that since I was so involved in the care of their health. So I was asked, I volunteered, I interviewed, I passed the interview obviously, and I've been on the council for 2.5 years, and I'm a charter member and helped create the charter and the council the way it looks.
I am the newest patient advisor at PeaceHealth, and I actually kind of fell into it really having a leader that I crossed paths with. Our daughters played volleyball on the same team, and I had went through some pretty traumatic stuff with a couple of surgeries. And one day we were sitting in a gymnasium, and actually I didn't know until I was talking about it, the actual impact that that moment had on me. And I'm in the middle of a gymnasium, and I start crying. And I knew this woman worked for an organization. I didn't know exactly what she did, but basically I said, this happened to me, and maybe what you're doing could prevent this in the future. And all of a sudden, I get an email from Patty Black saying, hey, can we meet you? We'd really like to have you as a patient advisor. And I was like, me? I'm a mom, you know. I was really surprised. And so I went through the vetting process. They obviously didn't dig deep enough. They know now. And I started May of last year, and I am getting as much from it as I'm trying to give to it.
Hi, I'm Kay Dickerson. We first came here around 95. We're Hurricane Katrina survivors. When we got here, I hadn't had any decent health care in quite a long time. My husband's disabled, so I had no problem getting him changed into our system since he was already hooked up on the federal level. But turns out I had several health care problems that required attention, and they said, do you have any insurance? And I was like, so they took me by the hand and they guided me and they worked with me for a couple of years. And I was fortunate enough to get on CareOregon, and I've really enjoyed working with them, and I've learned a lot. And now that my health care is so much better, I'm able to pay it forward to my community and give back.
So yeah, there's a little technical difficulty with that microphone, but I was just pretending like that was applause every time. So I'm now going to just ask the panelists to tell us a little bit about how their group works and the kind of interactions that they have with leadership in their group. And let's start with Margie. Margie, could you give us just a sense here at Providence? What's the group dynamic like? How do you relate to one another and to the administrators or other folks from Providence that visit with you?
Well, am I on? I don't feel like, can you hear this? No. It's on.
So we're gonna steal Cindy's microphone.
Okay.
Sorry, Cindy.
I love technology sometimes. There we go. How we work with, well, first of all, we're a council of about, I think it's about 15. And then we have leadership come in, and it's always a lot of the executive leadership. So we have a senior medical director that shows up very often, who's out there. And then we have the CEO and the CFO, and just everybody comes to the table. I mean, Cindy's at every single meeting, and they help us participate. And I just love the fact that leadership values the work that we're doing. Leadership wants us to be there. If leadership doesn't want you to be there, then what we do is not, we're just spinning our wheels. So having that interaction in a council meeting, or even coming to a meeting that is usually just all Providence employees, once we come to the table, it makes us feel like we're making a difference. So the interaction at our council meetings, at our subcommittee levels, even at standing meetings that Providence has had for years, and they've invited a patient on there, I feel like really has made a difference.
Thanks. And so just before we go on, so in your group, do you guys end up spending time with each other outside of the advisory council? Are you getting to know each other sort of as friends?
We haven't spent a whole lot of time. We've spent, well, Sam's waving because Sam and I have had coffee several times. Sam and I like to meet and have mochas. There are several of us, but mostly we meet within that time, but we also have a time, first part of the meeting is always a time to get together and get caught up and see how people are doing. And then there's always that, in December we always do something as a get-together just to kind of socially to spend time with our spouses and other council members. So I think we've developed some really good relationships over the past 2 years, but there was no set point time for us other than like at the beginning when we did some meet and greet type thing.
Thank you. So Dana, how about at PeaceHealth? What's your group like, and how do you interact with your administration?
Well, one thing we do is when we meet, we all share a meal together, which I think is wonderful. First of all, a lot of us are coming from jobs and you're in a hurry. And I can tell you if we didn't share that meal together, I wouldn't be eating until 8:30 at night. But I love that because you get a chance just to visit, not really knowing. I mean, I don't know any of the leadership. And so when I'm having dinner with them, I could be having dinner with the CEO or the janitor. And I think that's what I like about it, is that you really get to know someone by doing that. Also, I love that I thought when I got on the Patient Advisory Council that this was like, they just want to hear from us. They want to say they have an advisory council. You know, I'm not going to be very important and they're really not going to listen to us. So when I walked in, that was already in my head. I already thought that. And within the first meeting, I was blown away. I was blown away at the questions they were asking. They really wanted to know. They wanted to change things immediately. It wasn't something like, let's visit about it and, 7 years from now, we'll talk about changing protocol. I mean, they wanted to know before they even put it out there for patients to read. And so I was really pleasantly surprised that the leadership really did want to hear from me. Because as far as I'm a volleyball mom, I mean, that's really how I see myself. And I'm like, you have far more letters behind your name than I do. And I appreciate that you're asking what I think and you're listening. And so I think that was something that I didn't expect. But we have an open line of communication. They want to hear what we have to say, and I want to hear what they have to say. And I've learned a lot from it. You may have CEO at the end of your name, but there's a lot of restrictions that they have to deal with. I mean, there's the struggle between excellent health care and the money to afford that care. I never realized that. I looked at the bills that I paid and I went, what do you mean you don't have the money? And now that I am in the middle of it, I completely understand. And that's what they want to do. They want to give you excellent health care. How do we do that? But then how do we afford it? So.
Well, thank you, Dana. And Kay, how about the CHIA? How do you folks get along with each other, and what's your interaction with CareOregon administration?
Well, we've had really great support through Tamara, and you're always around to lend advice and voicing. We start our meetings with a meal. We actually tacked an hour on before the meeting starts so we can catch up with everybody. We're all very different people. We all come from different parts of our communities, and so all of our needs are really different. And it's fun talking about one person's grandchildren, or another poor person has a healthcare concern, or another person had housing concerns or something like that. We're always trying to help each other and come up with creative suggestions. We have a young mother that has lots of children, and she's always, help, I need menu ideas. And so we all have different needs and strategies, and so we always try to help each other. In the same token, our communities are different too, and so we work on different projects for the different neighborhoods that need different things.
And tell us about any orientation or training that you felt was really helpful in allowing that group to be able to be successful, or just for your feeling comfortable being involved.
Well, one of the most fun things we did earlier this year was we went to the Institute for Patient and Family Centered Care in Annapolis, Maryland, and that was a lot of fun. We had about 4 members from our group went on this trip along with Tamara, and we really had a good time, and we invited other people from our other groups along with us, and we made new friends, and we've really seen a good way to integrate patient and family-centered voices into different parts of the healthcare community.
So while you have the mic, I'm going to go on to the next question, which is
Okay.
just, can you give us a sense of a project that you guys have done together as a CHIA and sort of the results of that process and how that may have affected CareOregon?
Well, the most recent one we did was a project that was living well with chronic conditions. We had attended a workshop, and we liked it so much that we asked to have somebody come and teach us the workshop too. So we're undergoing that transformation, and we hope to be able to learn it well enough that we can go out in all of our different communities and spread the word.
Excellent. And Dana, how about you folks at PeaceHealth? Do you have a project or a process, something that you've seen really work for your group?
Well, as I said, I'm the newest advisor, and so I'm just getting on board with some of these projects. But what I'm really looking forward to is we are sitting on a panel with second-year nurses that are coming from Lane Community College, and I'm really excited about that. I think that the change in patient care is going to come from the very beginning, that it's something that is learned. And so I'm really excited to get to be a part of that. And they've been invited back. This is their 3rd year. So, that's a project that I think is going to make a lot of difference.
Mm-hmm. And Margie?
Well, we have quite a few, but one of my favorites was early on, and it's the after visit summary, and that's a piece of paper that you would get after you visit your doctor, which would have your orders on it, like take 2 aspirins, don't call me, or something like that. It's always a favorite of a wife when a husband brings it home because we know exactly what the doctor said. And we were having this conversation in one of our first council meetings, and we were surprised that half the council members weren't getting this after visit summary. And Dr. LeBlanc happened to be in attendance at that meeting, and he's one of the people who made decisions on the after visit summary. And when we first started the conversation, he was kind of leaning back, listening to us. And as we got more and more into this conversation, he started moving forward, kind of taking notes. And so his body language really changed, and that showed us that he was really getting engaged in this. But we also asked him some really tough questions on, like, why didn't every patient get one of these at their appointment? And so one of the other things is after that meeting, we formed a subcommittee. And based on what we heard in that council meeting, we formed the subcommittee that went for about a year. And what the outcome was we created a poster that's up in every clinic. We created a distribution process for that. We met with leadership. We actually went to a clinic and took pictures of us hanging the poster in the places that we thought patients were more likely to look at it. And one of my favorite places was, how many people like to look at the scale when they're on the scales? Are you like me? You want to just turn around? Well, we put one right up on the wall, right in front of the scale. So now you don't have to look at that number. You can look at this poster, and it tells you things that your AVS will provide for you. So that was one of my favorite projects to work on. We also had a great outcome. We had a 30% increase in those clinics that those posters were up in.
So in the audience today, we've got folks that staff the state's Member Advisory Council, a number of the representatives from the newly formed Community Advisory Councils connected to CCOs, which are a year old. So my last question for you is really give them some advice about what keeps you engaged. Why do you stay motivated? Why do you keep coming back? Give them a sense for their newer organizations. What is it that makes you as an advisory member keep doing this work?
The thing is, for me, is that leadership listens. Knowing that I'm making a difference in healthcare, knowing that a simple comment in a council meeting can create system-wide change, those are the things that are meaningful to me. Knowing that as a patient, that I actually have a voice. You know, it's funny because now that my mother-in-law knows that I'm on this committee, that every time she tells me when there's something wrong at the clinic. But in a lot of ways, that's good because I've developed a good relationship with our clinic manager now. So,
And Dana?
I think it's that the prospect of change, that's what really keeps me motivated and engaged. I joined this group of people because I had a really traumatic event at a clinic where I was in a wheelchair. I went from being able-bodied to disabled in an instant. And there was a fire drill, and I was sitting in this wheelchair, and they shoved 6 of us in a stairwell, and we were in the surgical and neural floor. And they left. All the able-bodied people left. That was the protocol. And I looked over at a man, and he had no legs. And I said, I have one good leg. And I said, I think I can pull us down this stairwell. Now, obviously, it still brings me to tears. But the woman that left us with the walkie-talkie had to say one sentence. The firemen will be coming to get you. But she did her job. Her job was get all the able-bodied people out, get the people that are in wheelchairs in the firewall. That was her job, and she left, and she did her job. So I can add one sentence, just one sentence, and no one has to feel like I felt again. And that's why I do this. Because I had a man look at me and say, nobody cares about us. And, you know, I now am able-bodied, and I want people to know that I do care about you. And I want to do something to forge that change, even if it's one sentence in one protocol that can make no one feel like I felt. And that's why I keep doing it. And I'm going to keep doing it.
Good job. Good job. How can I follow that one up? You want to repeat the question?
Sorry, I'll take a deep breath. That was powerful.
Really?
So, Kay, if you were directing advice to some of the newer member advisory councils about what keeps someone like yourself coming back and participating, what is it that motivates you, and what advice would you give them?
Okay. It's just speaking from your heart, as she did, and letting people know what your biggest frustrations are. As a wife of a disabled person, I have a lot of problems, too, with my husband's health care and him receiving the information correctly. And I'm another one that really enjoys the after-visit summary. Those are quite helpful because a lot of times when people are sick and people are not feeling well, my husband is dyslexic, and he'll say yes instead of no, or right instead of left, and the doctors say, on a scale of 1 to 10, how much pain are you in? And he'll say 2 when he really means 9. You know, so it's really important to listen to your patients. And just getting out there among everybody and making sure you're listening. I think listening is probably my best advice.
So we have a lot of time, and I'm going to make sure that plenty of it is for questions. But while I've got you, Kay, so I'm asking you to give advice to other organizations, including the state's member advisory council. But you're actually on that now, new to it.
Yes, I am.
So you have a chance to first tell us some of the things that, some of the opportunities that have come your way as a result of being on CareOregon's CHIA, and then also maybe specifically talk a little bit about the state's member advisory council and similarities and differences.
Well, I was really fortunate enough to be able to talk with Oliver Droppers that works with the state and work about getting on the state member advisory council, and we've been really working hard on different things and different aspects to help this rollout go smoothly. I don't know what else to say.
And how about the state task force you're on?
I'm also on the state task force for individual responsibility and healthcare transformation. We've worked very hard, and earlier this week we were able to get together 7 different suggestions for the legislature. Those suggestions have gone to the wordsmiths who will craft them and put them in legalese, and hopefully they'll be going on to the legislature before long about making sure that patients are engaged, and making sure that traditional health care has a voice.
So, Dana, if you don't mind, this is like a bonus question for you. But so they've done a really good job of practicing. I have to say this entire event was so well rehearsed, and Michelle and Tamara and Summer, who were putting this together, had us all come in and practice one day. So, but now we're in a little free flow. So I know you're nervous, but can you tell us a little bit about the questions that matter?
The questions that matter, it's really something that you can, well, this is how I do it. Because I'm one of the younger members on our advisory council. And so when I get a question that matters, I actually go on my Facebook page and I ask the question, and I get feedback from, just a huge demographic of people that then I can bring the input to the Patient Advisory Council, not just what I'm feeling and what I'm thinking, but from a large majority of other patients. PeaceHealth is the largest medical provider in our community. And so it's really a good way to bring information back to the leadership from patients, from people that are on the front line. And that's something that I've really tried to do. I feel like to be given such a great opportunity that I need to, in turn, I have a responsibility to other patients as well, not to look at things so one-sided. Another really wonderful thing, just from my very first meeting, I learned something that I think that I'll carry through however long my time is on the advisory council, and it was one of the senior leaderships brought a video about empathy. And it really made me think, you guys work within the medical facility every day, and so things seem second nature to you. But as patients, we're not. Some people have chronic long-term issues, some people have emergency issues. But when you see us, that's a crisis for us. And to keep yourself engaged and to remember, that day, you don't know what happened to that person. They may have got a really serious diagnosis. And to continue to have that empathy for people and realize that I know it's another day on the job for you, but you guys deal with life-changing events. And so I think that I will carry that through and hope when I speak to senior leaders and to medical professionals, we rely on you for our medical care and also for the kindness and the empathy. And if you don't give that, it can make it really traumatic. It's just not another day.
So I'm going to ask Margie one last question, but for those of you in the audience, this is a good opportunity for you to sort of think about questions you may want for the panel. We're about to open it up to be a little bit more of a discussion format. And if you are a patient advisor, it's also okay for you to stand and just give us a sense of how you might have answered one of these questions if there was something that struck you as information you'd really like to have shared. So Margie, we'll end with you, but I want to, when we were first doing the preparation of creating a member advisory council or a CHIA and working with the Penn Group, one of the things that got talked about a lot is what is the appropriate level of staffing and what's the relationship going to be between the staff and the advisory committee. So I know that part of the theme of this particular day is making that connection to the highest levels of executive leadership in companies and to the committee, but we can't forget that these only function well because of the Tamaras and the Angelas, and I'm just wondering, from your perspective, what is the right kind of staffing? What kind of support have you received? What really has worked in that relationship with the staff?
Well, honestly, it probably wouldn't have occurred if Angela wasn't, or somebody like Angela wasn't part of this process. She's our program manager. She's our cheerleader. She keeps us organized, which I'm sure it's like herding cats some days. But if leadership doesn't invest in somebody to be a program manager or program coordinator and doesn't allow you to have some administrative support, then this doesn't happen. I've been to several conferences, I've talked to several people, and a lot of times they say, well, yeah, we had a council, but it didn't work because, we tried to do it on our own. And if leadership, if the organization doesn't buy into it, then it's not going to happen, because you have to have a dedication. Providence has to be dedicated to having patient and family advisors, but patients have to be dedicated to Providence in the sense that we have to invest ourselves back into them to help them be better for the patients. Does that make sense? And, it was interesting. I got the opportunity to go back to Washington, D.C., and it was mostly all physicians and a couple of patient and family advisors. It was the Institute of, I'm going to get this wrong, Institute of Patient-Centered Medical Care or Home? Mm-hmm. Care, yeah, there's too many words in medical. I flunked anatomy, that's why I'm an accountant. But I went back and I was one of about 5 patients, and I had a doctor come up to me, independent practice, and he goes, how do I get a patient and family advisory council? And I had to laugh because it was kind of a social thing. We were talking and he kind of pulled me aside. One of his colleagues walked by and he said, John, you have patients, don't you? And so, and it's so true. And I asked him, I said, don't you have that 1 or 2 patients that just totally quiz you every time they come in? Or they come in with their parent and they start going through the list of things, and it started to click. And hopefully he'll walk back to his practice and go, I already have patients who want to be engaged. So what I find is it takes dedication from not only the organization, but dedicated somebody, an employee or somebody to really help hone this in. And like I said, herding cats, I think that's Angela's job. So.
All right, well, with that, we have about 20 minutes for a discussion with the audience, and I'm going to turn it over to Cindy.
I don't know if I'm on. Yeah, on. One of the things Anna said is it's really a partnership, and we keyed up a couple of the leaders in the audience to maybe talk about the leadership side. So you've heard from the advisors about how key it was to have leaders sitting at the table. So I know one of the leaders from Providence is Dr. LeBlanc, so I'm going to have him speak.
So, hi, I'm Ben LeBlanc. I'm the Chief Medical Officer for Quality for Providence Medical Group. And I think Margie loves to hear me tell the story, and I like to tell it. So she kind of alluded to it before, but this was 2 years ago. So I'm kind of giving you the leadership perspective. Didn't really know what to expect out of a patient family advisory council. I mean, it sounded like a good idea. And so that might have been some of the relaxed attitude as we're going through the meetings. And then somehow we got on the topic of after-visit summaries, which was something we had introduced in kind of a traditional medical group style. It seemed like something that was good. We had heard about, some people seemed to like it. We had built something, an electronic medical record, to make it possible. And we were just kind of waiting for osmosis for people to take this up. And one of the patient advisors was talking about how they really liked this thing that they got at the end of the visit, this piece of paper that summarized it. And there were a couple other advisors who said, well, I've never seen that. What are you talking about? And they kind of described it. And I said, well, that's the after-visit summary, and here's what we're doing. But then that's when the pointed questions came. Well, you're the chief medical officer. Why aren't all patients getting this? So that's kind of a different perspective. Before then, patients had been sort of an abstraction at the executive level, like we should do this for the poor patients. But this was a very pointed, very specific group of patients asking those questions. And it was great. It really changed my thinking on the power of this group. And as Margie said, it kicked off work that the committee took on to talk about after-visit summaries. It's a different discussion with the physicians when it's the patients that are asking for this. It's not Ben telling them they have to, print out this other thing. I said, well, the patients want it. I mean, you're welcome to come on Monday evening and talk with them. And so there's a huge power to that.
And then I think we also have someone from CareOregon that would like to talk about working with their patient advisors, your CHIA.
Hi, I'm David Lim. I'm our Medicare Program Manager. CareOregon also operates a Medicare plan, so we don't just do Medicaid. But our Medicare plan is a special needs plan. We serve both dually covered Medicare and Medicaid members. So we're truly serving the most vulnerable. One of the things that we did this year in our
Speak up a little bit.
in our bid cycle, from the health plan operation side of things, we go through a cycle where we determine where our benefits are going to be for the following year. And we met with a member, and from his perspective, he just kind of told a story of, he brought up sequestration and the impact on sequestration of federal programs and housing and heating and some of those things that he's a beneficiary of. But knowing the impact of sequestration, he was going to be asked to pay more for those things. And so from the health plan side of things, we really thought about, well, we can do a number of different things through the health plan operation side. Why don't we do something that frees up money in our members' lives so that they don't have to make decisions between, well, can I afford that prescription drug so that I can adhere to that diabetes treatment, or do something else. So we added a benefit where we hope that they no longer have to make those decisions, at least for those very key pieces of medications that they need.
So what questions do you have for the patient advisors? That's where I get my steps in today. Hi, I'm Erin Kirk from OHSU Family Medicine. I'm a quality manager at the Richmond Clinic, and Kay is on our board and also our patient advisory council. And because of all of your now exposure to so many different groups, could you feel like you could be candid with us and tell us what things really work, what could be better? I've been actually wanting to see if I could come spy at one of the CHIA meetings, just because I need to know.
I think that's a great idea. I had somebody before the meeting talk to me about having a meeting of community advisors from different places getting together, like people from PeaceHealth or people from OHSU and people from CareOregon with the CHIA getting together and sharing ideas. I think that would be a really plus idea for all of us. I think we could really help a lot of patients and family that way. And sharing more stories, I think patient sharing really helps a lot. Anyway, I can report that back to Oliver. Get everybody's voices heard.
My name is Floyd McCourtney, and I'm a part of CHIA. Mr. Dickerson, I first met you and your husband in 2008 when I was volunteering for Northwest Portland Ministries. What drives you to do what you do? You're on several boards, and I understand what drives me is that when Old Town Clinic, Too Sick Concern, extended an olive branch, that it inspired me not just to talk to people, but to help people any way I can. What drives you, and why is understanding crucial to you?
Well, one of the things that has really driven me is you were one of the first people actually that gave me a lot of incentive because of your kindness and your graciousness, because I realized that there were people up here in Oregon that had the same feelings that I did about making healthcare more accessible for all. I come from a medical background in my family, and we have doctors and lawyers and all that kind of stuff, so I was always interested in it. And I was really interested in making the patients' voices heard, especially going through Hurricane Katrina and spending hours and hours standing in line waiting just to get health care. It really puts the point across to people that are low income, really do need help and really do need health care. So it really inspired me to do more work and to make sure that people's voices are heard. Now, I'm also a TriMet writer. Most of you are from around here in town. Everybody knows about how the TriMet system works, and it's a good way to get out and meet your community and look at the front line. Be surprised what you can learn waiting on a bus about somebody's health care. I hear lots of nodding heads, huh?
I'm Samuel Weiss. I'm the patient engagement representative on the expert oversight panel of the Patient-Centered Primary Care Institute. And I'm wondering if you all could come up with things that the sponsors of this meeting could do to assist the other institution practices, what have you, of supporting and developing their patient advisory councils. I know that the internal is helpful, but are there external things that would help you as well?
Well, this is something that I know is in the works, just because my patient advisor coordinator, we were just discussing this, is us having teleconferences so that we can bridge our patient advisory councils. I think that it's really important. I think that we could really learn from each other's ideas. Something like this is wonderful, but actually having that patient advisory council experience, sharing that together, I think that would be a wonderful thing. And like I said, I know that they are moving towards that, but any help in that area, I think will make a huge difference.
A little theme here, back and forth. Apparently, I am getting my health improved today.
So I'm Oliver Droppers. Nick Kay called me out. I serve as staff for the Oregon Medicaid Advisory Committee, and so we're the statewide advisory committee for the Oregon Health Plan. And I don't so much have a question, just a couple of observations and reiterate some comments that have already been shared this morning. First, I want to say thanks to the three of you for your work and for your really helping, I think, nudge us and think often at an organizational and state leadership policy level, some of the real issues that we need to be addressing. Sometimes we look at the data and the data says one thing, and it's really the voices that I think really tell the story behind the data. So that's critical. I think just having individuals on our state MAC, as we call it for short, really has changed the tone and the direction of some of these important policy questions that we're asking, and it's been invaluable. And I also just want to thank Martin and Tamara for CareOregon and their support in doing this work has really helped the state MAC and having individuals such as Kay be a part of these discussions and at the table.
Thanks. So I heard some comments earlier about how there's a lot of words in medicine, and I certainly agree. And I think those of us who work in policy and do things, we have to speak in a certain language at some times, but I know it's important to speak the right language. So maybe a question to the panel, what can those of us in healthcare do to make these conversations more accessible to you?
Ask us the question. I mean, that's the big thing. One of the things that we've strived with was several of our posters, brochures, looking at the level of language on it, and making sure that it's understandable. Also, can it be translated into other languages? There's been several projects that we had, one with TVs being installed in some of the clinics that have slides that go through that talk about different things, maybe your flu shot or this thing, and it's it's translated into different languages, so it's meeting the needs of that clinic. So I think my thing back to you would be just ask us the question. Sometimes if the question isn't asked, then we don't know.
Yeah, and I always use the example that I had a doctor an amazing doctor, who was just really frank with me. I had gone through several surgeries, and I was kind of at a crossroads in my health and how I was going to move forward. And I had this doctor who just spoke very frank with me and said, I want to talk to you. I know you, I've met your husband, you're a delight, you're a wonderful patient, and you have such a bright future, but you need to do these things. You need to make these changes in your life. And it wasn't with big words. It was just sitting there, just my doctor, this specialist, this brilliant woman, talking to me just like we would have been sitting in a coffee shop. And I think that's something that medical professionals forget. When I started on the advisory council, I got a 3-page acronym, by the way, if they say these things, and I went, no, no. You giving me this paper tells me. And so I think that's really important, just to communicate with us. Yeah, you guys are so intelligent, and it's so above, my process level. So just talk to me.
Medical literacy should not be a second language. Okay. I've been working really hard on medical literacy. You have to remember that most of the people that you're talking to have a 6th, 7th, or 8th grade level of understanding when it comes to reading and understanding medical terminologies. My husband had an abdominal surgery last year, and I understood what was going to happen to him, but he had no way to understand it. Imagine my delight and surprise when his doctor came in and started talking to him about plumbing. My husband was right with her. I had no idea, but they were happy, so it was good, all good for me.
So I'm curious, this is a great start as patient advisory committees come together. My name is Tim with Providence and Mission Integration Team. And one of the curious things that I have is who else, given the fact that with your experience so far, who else is missing at the table? Are there voices or people that we're missing still?
I think at ours, a lot of the meetings that I have attended, it is senior leadership that attends most of our advisory council meetings, which I love. I learned so much from them every single meeting, but I would really like to have more frontline staff, which are the people when I'm calling my doctor's office. Those are generally the people that I'm dealing with, and I would really enjoy to have more frontline staff, more medical assistants, more admins, more receptionists, because they really are for a patient, that's the front line as far as I'm concerned. And so I think at our table, since I have been there, that's the part that I'm missing, and I'm hoping that we can get more involvement with those nurses and CNAs and the people that we deal with so often.
That actually sounds pretty good too. That's one of the advantages of developing a relationship with my clinic manager, because I have gotten a voice in the clinic. I know that we're starting to go into clinics with smaller councils, so we are bringing those people on into that setting. I think the makeup of our council, we had a gal who was a mom, a young mom with several children. I think we kind of missed that. So demographics-wise, we probably need a couple younger people. Although I am only 25, but for some reason I'm just not young enough. So, oh look, feedback that told you I'm lying there. But yeah, I think you hit it right. I think sometimes even the frontline people, because those are the ones that make the best. Those are the ones that either make the best or worst impression of your system. Is those people.
And since CareOregon is a different type of organization, I also want to mention customer service. Customer service is always frontline people too, and they go by different names. I might call them receptionist or whatever if it's in a medical setting. But definitely customer service is frontline. They're way overlooked. They're very hard work. Oh, wait a minute. I was in customer service for a number of years. But there are people that know what's going on. They are on the front line. They know what patients are looking for. They know what questions they have. They know what to expect when the phone rings. So I definitely think customer service should be included.
Hi, my name is Shelley Bittner. I am a relatively new hire at PeaceHealth, and I work on patient-centered medical home initiatives across the system. And I'm looking forward to meeting you, Dana, and I appreciate you being here. I am curious if any of you are involved with initiatives that have clearly been called out as patient-centered medical home, and if you are, what those are.
What was that?
Patient-centered medical homes. Yes, we've had several things. In fact, Bryant will be up talking in just a little bit here about some of the things that we have done, not to steal his thunder. One of the things that inside your packet that you got today was a brochure that we as patients created a subcommittee that worked on that, and that is one of the documents that is available to patients to explain to them what a patient-centered medical home looks like. So I'm not going to steal his thunder. I'm going to let him surprise you with his talk.
And we just discussed at our last meeting, and I think this is crucial, is mental health being a part of that patient-centered medical home, having someone in mental health that is immediately available to each one of those teams, whether it's something that's scheduled or maybe a patient comes in crisis. And I think that the mental health aspect is something that is missing and could just make a huge difference. And so I'm really hoping that we see more of that in the future as well.
I'm Carolyn Brown. I'm new to the Advisory Council, and one of the things that I wanted to tell the leadership is that when you're talking with a person of color that is a different culture, don't be so quick to talk down to them. They're human beings just like you and I. And example was, this wasn't in a medical situation, but it was a Caucasian man who came to me and said, "Hey, what's happening?" And I looked at him and I said, "Would you say that to me if I was white?" And so he was coming to see me in some office or something, and I said, "Now do me a favor." And he said, "What's that?" I said, "Go back outside and come back in again and talk to me." But basically a lot of people assume that because you're a different culture or a different color that you can talk their language, but you really shouldn't, because to me it's an affront. So you basically need to talk to people just like you would talk with someone else, but at the same time you don't want to overload them with medical ease either. And be personable, and that's what I'd like to impart when I go to the council, is that we are human beings and we need to be talked to just like another human being.
We have time for one more question.
One more.
Can I change that mic?
Fresh mic.
There's more power in this one. Yeah, hi, Dr. Rajani. I know many people attending today, and I've had the pleasure of coming to our Providence Patient Advisory Committee on a couple of occasions, and really enjoy coming to those meetings. So thank you all for your participation. My question kind of follows along on some of the diversity type discussions that have been going on already. And I just wonder if when we look at diversity, it's not just difference in color or difference in patient lifestyle. Could be also difference in patient disease processes that need to be represented at the table. But I wonder, how much are we doing to represent different diversity needs onto the panel, and what gaps do you feel that exist right now on your panels in terms of the diverse nature of the patient populations that we're supposed to be serving?
Well, I know that when I went through the process to become a patient advisor, they really did check and see what aspects of their healthcare system had I been a part of, and I just happened to be a part of a lot. Pediatrics, internal medicine. They wanted me to be, it wasn't necessarily that I was a woman or the age or a mother or a color, but it was the overall patient experience. You know, what parts of the system have you been involved in? Frankly, the only part I wasn't involved in was mental health, and we all know that that was a big mistake. I'm pretty sure they'll be referring me there as soon as this meeting's over. But I feel like our advisory council is really trying to make sure that they get diverse economically, you know, by age. I really think that they're trying. But it's finding people that are comfortable having an opinion, being a voice. That's why I did it. I was comfortable to do that, but there are a lot of people that aren't. So it's really keying in on those people, just like the administrator did on me, saying, oh, you'd be perfect. And so you guys, I agree with your statement, which was you guys know who would make the best patient advisors.
Yeah, and I think as Providence, as the little mini PFACs are in the different clinics, they're going to pick up the people that are within those clinics and within those communities. We found it to be a little bit more difficult at this more executive kind of PFAC level. And I don't know why. We've had people come through just because of different life situations, they haven't been able to stay. But I see that as these go into the clinics and they're in the neighborhood, that's where we're going to get a lot more diversity, and that will funnel up through to this Patient Family Advisory Council that we currently have.
A lot of things that the CHIA has done is one neighborhood we did a flu shot clinic, another neighborhood we had a Boys and Girls Club meeting. It just depends. Another neighborhood we did high blood pressure screenings. It just depends on what's going on in any one of our members' neighborhoods where we have a certain amount of concern over a certain health problem. Elders and disabled, pedestrian walking.
So we're going to wrap up the audience questions, although I do feel compelled on behalf of CareOregon to mention that at the very beginning of the process, we were told if you don't start a Spanish-speaking group right now at the beginning, you'll always put it off and it'll never happen. I think it was Denise's advice. And we don't have a Spanish-speaking group yet after 2 years. It is one of the harder challenges, but you end up getting caught up in your work and you never get back to that challenge. So that's neat. Let's start by giving a big hand to these folks. They did a fabulous job. And I also want to give a big shout out and hand to Michelle and Tamara and Summer, who did the dress rehearsal and prepared us so well. Thank you, guys. And then we're from such an interesting and unique state. You know, we have representatives from the State Transformation Center. Krista Mars is here. We have Oliver here from the state's Medicaid Advisory Council. This isn't just a commitment of 3 large systems, CareOregon, Providence, and PeaceHealth. This is a commitment on behalf of the state of Oregon. It's reflected in policy and in your attendance and participation. So let's hear it for Oregon. Yes, Oregon.